Hi, good afternoon. My name is Claudia Maldonado. Today I'm gonna give some examples of the projections that we would take for a patient who is on trauma, food trauma. So there are two views, two minimum views for the food projection, which I'm gonna show today, and it's gonna be the AP and the lateral projections. When we use the DR systems, we're gonna be using a KBP of 70 to 80. And we are also gonna use or need a 10 by 12 cassette. So this is what we do. I'm gonna position myself like if I would be on trauma. So it is essential to have a pillow. The IR has to be angled. Either if we have a cassette holder or we can hold it with a pillow or bags. Whatever you have and works for you, it's fine, as long as you don't drop the cassette, of course. Okay, so to begin, I'm gonna start with my foot. I have to make sure that the cassette is aligned on mid-side or plane. If the tube is angled, I have to keep the foot elevated so I don't clip when I get the projection of the calcaneus. So I don't clip the calcaneus. So once the foot is here like that, and this is angled, pretending that this is the collimator box, we have to make sure that this is parallel in a relationship to the IR. So we're gonna pretend that this is parallel with a 40 SID. I would say like this is parallel. Once this is parallel, we're gonna angle the tube 10 degrees posteriorly. So it will be like this. 10 degrees posteriorly towards the calcaneum or the posterior plantar surface, whatever it works for you. Okay, and then the center ray, it's gonna be right here on the middle of the foot. So these are the tarsals, these are the metatarsals, and these are the phalanges. So right in the middle of the T tarsal metatarsal joint, that's where we want to get the center ray. So it is like that. That it's easy for the AP projection. So now for the lateral projection, what we're gonna do is we're gonna keep the foot on the same position since it is a trauma, and then we're gonna hold the cassette like this. We want the foot center as close as possible to the IR because we don't wanna create OID. So this is what we do for the lateral projection, and we are gonna center it here, being careful to include all the light. So whatever that we see on the shadow, it's gonna come on the X-ray, and we're gonna make sure that we don't clip anything. For example, here I see the shadow, and then this has to be straight. So that's it for the trauma position of the foot. Thank you so much for watching my video. Have a good night.